Good afternoon. We are here today for a webinar as part of our grad series. And this webinar series is supported by PED through a grant from the Office of Adolescent Health. And we are partnered here at Envision New Mexico, have partnered with the New Mexico Alliance for School-Based Healthcare to present a series of webinars on topics relevant for expectant and parenting teens. So we have Nancy Rodriguez and Kim Stanek here today from the New Mexico Alliance for School-Based Healthcare, and they're going to be talking about one of their health literacy tools. So I will turn it over to them now, and thank you guys for being here today.
Thank you, McCain. So the New Mexico Alliance for School-Based Health Care, in partnership with the Public Education Department, has created in the last year a youth health literacy guide, which is available on our website. And there are many tools as part of that guide, but the one we'll be speaking about today is called the Parents Self-Assessment Worksheet on Child Health Care. And this is a tool that we're recommending for use in school-based health centers and grads classes or by other grad staff with grad students. So we have a couple of objectives today that we're going to be trying to accomplish. We're going to review the importance of sharing health literacy tools with adolescents, especially the expectant and parenting teen population. We're going to look at quite a few of the tools that are a part of the overall youth health literacy guide. And we are going to review and discuss a couple of options for how you might utilize this one specific tool, the Parent Self-Assessment Worksheet on Child Health Care. And we're going to have some options that you could do with individuals or groups, whether those are patients or students. So as I mentioned, the Alliance is a contracted partner with the New Mexico Public Education Department working to build collaboration between school-based health centers and grads programs to support expectant and parenting teens. We hope that many of the tools in our collaboration, including the Youth Health Literacy Guide, help expand healthcare access for expectant and parenting teens through the school-based health centers and beyond. And we feel at the Alliance like health literacy is a critical skill set for all youth, but particularly for expectant and parenting teens, since for themselves and for their children, they're going to be having a higher rate of utilization of the healthcare system. So last year, in partnership with PED and with some expertise from Envision New Mexico as well, we created this multi-tool guide that has a number of tools that we got from other sources, as well as ones we adapted or created from scratch that teachers or providers can share with expectant and parenting teens. So the Alliance has adopted informally our own definition of youth health literacy. We are sharing with you here on this slide the AMA's definition of health literacy, and a lot of healthcare providers focus on the literacy level of patients and how that's an obstacle to helping them make appropriate health decisions. But when we talk about youth health literacy, we are focusing on navigating the healthcare system, understanding healthcare and the healthcare system, and becoming a self-advocate in the healthcare system. Particularly students who are accessing care through a school-based health center may have a unique opportunity to learn about the systems as opposed to be needing support around their reading and mathematical literacy to utilize the healthcare system. So in those three categories, our Youth Health Literacy Guide has a number of tools that help navigate the system, understand the system, and become an advocate. And the tool we're looking at today actually fits into a couple of those categories.
So we're going to do, this is just an overview of the entire health literacy guide. It's divided up into 4 chapters. And so we have chapters 1 and 2 that contain tools on broad health literacy topics related to navigating and understanding the healthcare system, and then advocating for your health as a young person across the adolescent population. And then chapters 3 and 4 are specific to health literacy information for expectant and parenting teens. The Youth Health Literacy Guide is a living document, so it has many tools that you can use in the classroom setting, one-on-one for case managers or mentors, or one-on-one or in group settings within the school-based health center setting. that Nancy's going to talk about a little bit later. It can be downloaded from our website, from the New Mexico Alliance for School-Based Healthcare's website. And it also was given to all grad sites during the fall training. So hopefully you guys all have that if you are a grad site. And we'll have the newest version, hopefully, available in the spring, and we're going to be doing it on USB flash drives for all the grad sites. So if you have any suggestions about tools that you think need to be included, questions about the Health Literacy Guide as a whole, or suggestions about how we can enhance certain tools, Nancy and I are very open to your feedback, and you can contact either of us. And then we're also available to provide technical assistance related to the Health Literacy Guide. So again, feel free to contact us if you need suggestions on how to use other tools within the guide that we're not talking about today.
And one tool that we're going to be creating, which will not be more than likely available on our website, is a tool that we're going to be providing to some grads folks at the 2016 grad spring training, which is a Family Feud style game show which uses information from the Health Literacy Guide, but because of copyright concerns and the size of that PowerPoint document, we probably won't be providing it on our website. But if you're interested in using it as a classroom tool or for groups in a school-based health center setting, let us know and we can try to get you a copy of that. We're trying to bring this guide to life so it doesn't sit on school-based health center or grads program shelves, but it's something that you can use to meet the curricular and healthcare needs of young people. So now we're going to switch over to one specific tool, and when we get to the reference slide, you'll see that this is actually an adaptation of some tools that are provided in another location, and we'll talk about that when we get to the reference slide. But this is one of two self-assessment worksheets that was created for the Youth Health Literacy Guide. One is focused on doing an assessment of your own ability as a young person to access care, particularly as you transition out of care or out of school and need to access care. And this tool that we're going to be looking at today is focused on your readiness as a young person to access care for your child as a parenting teen. So either of these would be useful for students, but we wanted to focus on this particular tool because we feel like it helps the young people and the outcomes for the child as well. So this tool is asking the individual who uses it to focus and reflect on three categories: their general knowledge about the healthcare system and using that with their child, specific healthcare visits, and healthcare maintenance. So there are questions in each of those three categories, and students, and whether it's your patient or in a classroom setting, rate their ability to do the activities with no assistance, with some assistance, with a great deal of assistance, so that they themselves can reflect on what needs for support they have, and so that they can let the adults that they're working on this with know what kind of support they need. So if an expectant and parenting team completes this worksheet, they could hopefully set goals around what resources they need to seek and what skills they need to build, and either work on those individually or with the support of school-based health center providers or grad staff. They could hopefully build those school skills for their own benefit and for the benefit of their children. So that is a thumbnail, and hopefully you can see this relatively large. If you download our Youth Health Literacy Guide, you'll be able to print this individual page. The Health Literacy Guide is in a PDF format, and you can download just this one page to give to students or patients, and we wanted you to see it in sort of a larger format here so you could get an idea of how you use it. One of the things we don't talk about on the other slides in terms of ideas for how to utilize this is that if you have small amounts of time, either in a patient visit or you can't dedicate an entire class period for a grads teacher to this, you could break it into three categories and just have the general knowledge be reviewed with a young person, or just talk about healthcare visits if you know a young person is about to go on their first infant visit with their child and so forth. So there's a lot of options about how you could use this. You know the needs of your students and patients best, and we hope there's some way that it'll be useful. So we did want to give you some concrete ideas, however, about how you might use it other than just as a handout. So we break this down in using it with groups and using it with individuals. And we also broke it down into patients for school-based health center and students for the grad staff. So for school-based health center providers or other primary or behavioral health care providers who might be working with expectant and parenting teens, here is an option for you. So this example that you see on this slide is having an individual patient complete the assessment and working on setting some goals. Envision New Mexico, who does a lot of quality improvement with school-based health centers in our state, has often encouraged school-based health centers to use motivational interviewing in working with students when they're setting goals. And so we want to encourage anyone who's using this self-assessment to use that same style to address things that might come out of this assessment with young people. Expectant parenting teens already experience being told what to do a lot. So we feel like if you use MI and let them choose what they want to work on their own, that may be the best bet. So I am not a trained MI expert, but based on the little MI training that I have had, I created a couple of examples of statements and questions you might want to use, but if you need additional training through Envision New Mexico to become more of an expert than I am on MI, that is something that's available to you, and you can visit Envision New Mexico's website to learn about other webinars about MI. But here are a couple of examples. If you have a student, you could even, in a school-based health center setting, have a student complete the print assessment in the lobby and have it ready for the visit if you know they're an expectant and parenting teens and you've already seen them before and this is a follow-up visit. So you might say, tell me a little bit about how you access care for your child. And if the school-based health center actually can see an infant, then you might even talk through with them how they could use a school-based health center for their child. You might say supportive statements like, it's clear that you really care about your child, which is really important to reinforce with an expectant or parenting team. Or you could ask, is it okay for us to talk about setting some goals around your assessment? And because there are a number of items on that assessment in a one visit, you might just pick the one that they're most interested in working on and have them work on that. So here's another option if you're a grads teacher, case manager, fatherhood mentor for working with individual students and using this assessment. Or if you're another caring adult who has happened upon this webinar and would find it useful, you could have them complete the assessment and review the results together. And if you have access to the entire Youth Health Literacy Guide, you could try to look at areas where they've identified needing a high level of support and look to see if there are tools in the Youth Health Literacy Guide that educate them around that. And one of the things we've talked since we provided this Youth Health Literacy Guide last year to grads teachers, one of the things we've heard from grads teachers and that they've told us is that they say to expectant and parenting teens that these are skills that adults often don't have. They shouldn't feel ashamed because they're a teen parent that they don't know how to do this. Most adults don't know how to utilize the healthcare system to the best of its capabilities. So if you want to say something like that to the student, that looking for other tools that you as an adult might need to look in the Youth Health Literacy Guide to help them figure out how to meet that need, because there's lots of adults who don't know how to use the healthcare system in the best way. And Kim is going to tell you in a minute about a crosswalk guide that's a part of this slide deck, that if there are areas on the assessment that they show a high need in, it helps you crosswalk to some matching tools. And you're welcome, if there aren't tools in the Youth Health Literacy Guide, to follow up with us and we can try to help you with other resources so that you can meet that student's need if they've shared with you that there is a need. And hopefully if you're, say, a case manager and you're meeting with a student one-on-one, you would have them set a goal and report back to you so that there's accountability to help encourage them to meet their goal. Now we're going to talk a little bit about how you might use this tool with groups. And this, having especially expectant and parenting teens share what their weaknesses are with a whole group can be challenging. So we wanted to offer some suggestions about how you might best use this. And I think that, as I mentioned a moment ago, emphasizing that most adults have weaknesses in this area could be helpful and important, and that particularly for expectant and parenting teens who are living with the grandparents of the young child, they may be able to help their own parents with some of these things because adults don't know how. So if an expectant parenting teen is relying on their own parents to help them make all of the required immunization visits for their infant, their own parent may not know how to do that. So using this tool involves no shame. It's just a smart thing to do. So if you work in a school-based health center or other clinical setting, for example, if you're a behavioral health provider who runs a support group for expectant and parenting teens, you might want to have the whole group complete the self-assessment and discuss what goals they want to set based on the results, as opposed to having them share all of the results. And that's sort of an MI way to have them look at their own paper and not feel forced to share all the results, but pick one or two things based on their own analysis about what they would like to work on. And then as a grads teacher or case manager working with a group, or a fatherhood mentor who has a number of fathers, if there's some commonality, let's say quite a few of them don't know anything about immunizations and don't know how many immunizations are recommended for infants, or they need to make sure their child is on Medicaid and they don't understand how to use the benefits of Medicaid. You as an adult who's working with this group could invite people to speak based on this, and you could share that fact with the students in advance, that them being willing to open up and share where they need support will help you as an adult bring in outside experts to share with them how to use the system. And Kim may talk about this more later, but I want to mention that we have some other tools on our website. If you go to our resources tab, there's a sub tab called Grads and Parenting Teens, and we have a series of briefs. A number of them are about collaborating with school-based health centers and grads to serve this population, but there's one right now that's there and it's available about Medicaid rewards programs for pregnant anyone who's pregnant who's on Medicaid, or anyone who has an infant. So for example, if you go to 3 prenatal visits, you get a gift card to Old Navy to buy, maternity wear or whatever. There's a brief that describes those programs that you could use if students identify some gaps through the self-assessment along those lines. And Kim is working on creating a new brief that will be on our website soon that's about the travel rewards that you receive as a Medicaid beneficiary in New Mexico, so that if transportation to healthcare is a challenge for young people, that brief can help you as caring adults explain to them how to use the Medicaid travel benefit to get to their prenatal or child's doctor's visit. So please feel free to access those tools as well, either generally or as a follow-up to completing the self-assessment with a group of patients or students. So for grads teachers, if you're doing this in a true class setting, and particularly if you have a whole class period to devote to this, this next bullet is an example of how you might make this a little bit more interactive, but still allow the students some privacy in completing the self-assessment. You could ask them to complete on their own to give them some quite reflective time, but then ask them to break up into groups, either in the 3 categories, general knowledge, patient visits, and so forth, of the assessment, or in whatever other fashion you feel like is appropriate, and discuss with each other what goals they want to set. So one thing I know that a grads program did with one of our previous tools was split their class into students who already had children and students who were pregnant, so that they could talk about the things that were particular to them. So you might consider doing that in a classroom, so that if they're really focused on visits that happen after their baby's 3 months versus a pregnant young person who's planning for the very first postnatal visit, they might have different needs, and you could group them that way. But then you can have them discuss their goals and identify the resources or support they need, and then have each group report out and have someone be a secretary and report out to the case manager or teacher, so that adult can either answer questions if they know them off the top of their head, or make a list of needed outside support for the group. And again, we don't know everything or have all the resources, but we did a lot of research to create this youth health literacy guide. So we are more than happy to try to do research to find the resources or support you would need to answer student questions or get support for them, particularly as it relates to Medicaid.
So this is the crosswalk that we created, and you'll notice that there aren't necessarily tools for every single question that's on that assessment tool, but we did pull out the ones that were most relevant and that we think are the strongest to help support expectant parenting teens who maybe need a little more confidence or a little bit more knowledge in these particular areas. So I'm going to start with the very first section, that general knowledge section, and the Youth Health Literacy Guide tools 4, 5, 6, 7, and 8 over there in the red that you can see on the left-hand side will be relevant for those teens that identify that they either do this with some help or they don't do it at all or do it with lots of help based on those questions. So 4, 5, and 6 are all related to paying for healthcare and understanding health insurance. And like Nancy said, as adults, a lot of us adults don't even know how to do some of these things. So these aren't ways to make them feel like, you know, just because they're a parenting teen, they don't know how to do this. A lot of adults struggle with this as well. So those are all related to paying for healthcare and understanding the health insurance. And then 7 and 8 are related to finding a healthcare provider, either for yourself or your child, and making healthcare appointments either for yourself or your child. So the tools themselves are directed at the teen themselves when you look at the tool, but it can be used for them to advocate for their own child, to call in to make an appointment for their child, to find a particular provider, whether it's a specialist, a pediatrician, behavioral health, whatever it might be. 7 and 8 can also be used down at the bottom in the healthcare maintenance section, question number 5 there, and so can 4 and 5. So you can see that you can kind of pull based on what the needs are and pull those tools out and kind of use those as separate lessons or supplemental material. Tool 2 is related to where to seek care, and it's a really good go-to guide, and it can be used by your students and patients as a way to help them explain why their child might need to be seen for a visit and where to go based on those symptoms. And then your middle section there, the healthcare visits, there aren't as many tools for that one, but tool 15 is a really great printout card for young parents to bring with them to appointments, and it really helps them feel empowered and be able to advocate for themselves and their children in terms of what questions they should ask, what information that they should be sharing with their healthcare provider, and really being part of that conversation with what care they're getting and what care their children are getting, so that it's not just them being a recipient of the care and whatever the healthcare provider says, that's fine, and you know, I just do what they say, that they can actually engage and understand why they're getting that care, why their child needs that care, and share information on their concerns. So it's a great printout. They can keep it, they can bring it with them. It has some really great questions. So those are some really great tools that you can use. And then as Nancy mentioned, the transportation brief, which is in the making and should be ready pretty soon. We're working out some kinks with the managed care organizations in terms of some of the logistical information, but that is going to be a really great brief to help the expectant parenting teens access the transportation benefits that Nancy talked about. So that if they are living somewhere where they don't have transportation or they don't have their driver's license or whatever the case may be, that they can get to their appointments and they can get their children to their appointments. And this tool, the crosswalk here with the red numbers on it, is also available as a standalone document if you want to download it. That way when you're doing the lesson, you can directly reference to those tools without having to come back to the slideshow.
Here's what that looks like if you want to see it a little bit larger. And going back to the transportation brief, I really want to encourage everybody who looks at this webinar to go back and download the brief that Kim is writing, because our sense is that this is an underutilized benefit of Medicaid. I think a lot of seniors know how to use transportation benefits, but most others do not. as evidenced by the fact that Kim has had to do a lot of research and that the folks at the subcontracted agencies that provide the transportation themselves haven't been able to answer some of our questions about whether minors can access this benefit and how and at what locations and so forth. So I think especially if young expectant and parenting teens are in a rural area that do not have bus systems or are too young to have a driver's license and maybe are not involved with their own parents who might be able to drive them, this could be a really great resource. And again, there's no shame in using this information because we have found that very few people understand it and utilize it. So they may be more in the know than the adults in the community if they utilize the transportation benefits, and it's part of what they've earned as being a member of Medicaid.
Great. We had a question, Nancy, that will this be, once the transportation brief is done, will there be another webinar about transportation benefits?
We actually are having a follow-up webinar about both of the briefs that we mentioned, so the transportation brief and the pregnancy rewards brief, so that people know how to take advantage of that. And if individuals are interested in the general Centennial Care is what Medicaid is called in our state right now. So if you even wanted to Google Centennial Care rewards, there's a whole subset of rewards programs that can be accessed by Medicaid patients. And then there are these lesser known and specific kind of rewards that we're trying to explicate for people because they are complicated. They change a lot, so I would encourage people, even if they attend the future webinar or even if they read our briefs, to always contact. In the case of a teacher, you would be working with a student or a provider working with an individual patient, have them contact the individual managed care organization. There are 4 different ones that provide these state benefits, and they're all a little bit different. And so you have to contact the individual managed care organization. And one thing that I think we'll emphasize at that future webinar, and that Kim and I have both emphasized in these briefs, is that expectant and parenting teens who are on Medicaid should and do have access to care coordinators as a benefit through Medicaid. And not only could teachers and providers be using these briefs to help them access these rewards programs, but the care coordinators that they would get through Medicaid should also be aware of these services and could help them through what can be kind of a red tape sort of situation to access these rewards. I think that transportation is a little more complicated than the pregnancy and infant care rewards. So we would encourage, if school-based health center providers or grads, teachers, case managers, and fatherhood mentors don't know about care coordination, find out, learn, and encourage your young people who are Medicaid recipients to get a care coordinator because they're entitled to one. And I am sorry, Michelle, you may know the date of that webinar right off the top of your head. I do not, or Kim may remember. March something or the other?
10th, I think.
March 10th.
And to add on to the transportation brief and the care coordination, we are putting a reference piece in there so that you can reference based on what managed care organization you have, who to call to get a care coordinator if you are a teen or somebody who's helping one of these teen parents access these services, because they, like Nancy said, should be able to help you navigate that system more than even, the brief would be able to help you navigate it.
Okay, so we saw the large crosswalk, and going back to what Kim said earlier, we want to encourage anyone who might, anyone in the universe who might stumble upon this webinar, but particularly New Mexico School-Based Health Center and grads staff who may see this. If you see a gap, if you use this tool and you say, okay, number 4 under healthcare visits is where you guys didn't have any tools in the crosswalk, you didn't have any tools in the Youth Health Literacy Guide, and that was the number 1 thing my students or patients asked me about. Please let us know that, because that will trigger us to create or find a tool and add it to the 2.0 or 3.0 version of this Youth Health Literacy Guide. And I picked number 4 in particular because breastfeeding is something we've already heard feedback that folks want us to add to the next version. There aren't that many teen-friendly breastfeeding resources out there. In fact, none that we know of. So we're looking to try to find and or create some tools, but at a minimum we will include some general breastfeeding tools in the next version. But if there are things like that that you see a need for that you can't find yourself, please let us know, and we will either try to find it for you immediately to provide to your students or include it in the next version of the Youth Health Literacy Guide, or both. So I know we don't have a lot of participants today, and so obviously we are available to the best of our ability if folks are watching this through a recorded webinar, if you want to contact us with any of your questions. But for the few of you that are here, I think we'll at least give you an opportunity. And here's some questions that we brainstormed, but we're happy to answer anything else you may have thought of as we've been talking. And I'm not going to read all these questions. You can read here. Well, I think we have one caller who's calling in who can't see the slide deck. So if there's anything else you want us to ask about the tools or our intent, if you already have suggestions for additions to the guide, if you want to share anything from your experience about how health literacy comes up for young people, or anything about the healthcare challenges they face, we'd be happy to field any questions on those topics. And if not, then we will just share a little bit more about the tools in our Youth Health Literacy Guide. Okay, hearing and seeing no questions, we're going to move on to one tool that Kim mentioned. Kim, do you want to kind of walk through this a little bit?
Yeah, this one. So this is tool 15, and this is the tool that is you can print it out. It can be a standalone card that would be front and back that expectant parenting teen or any adolescent that you're working with could bring with them to an appointment, and it reminds them of the different information that they should share about themselves. And again, this is directed towards them, but if you talk to them about this tool as a supplemental knowledge guide, you should tell them that they can use this for their children and how to phrase it with their children. It goes through, information about what physical symptoms you or your child might be having, mental symptoms that you might be having, social situations, relationship, any medications, and it really, I think, reiterates the youth, especially expectant and parenting teens, really need to be advocates for their own health, and it empowers them to be able to do that with a quick reference, so that if they get in there, I mean, even as adults, we get into appointments and then afterwards you go, oh gosh, I really wish I would have asked this, or I would have, told them that I was having this symptom or my child is having that symptom. So this is just kind of a way that they can use it as a rehearsal and then bring it with them. That way, if they're going through the appointment, something comes up, they can go, well, why? Or this is the symptom that they're experiencing. Is there other ways that we can, treat this? And so on and so forth. So.
And I would say, I think, having a card and potentially losing it is definitely a potential with this age group, and you could even have them like take a picture of it with their phone, because often they have their phone and know where that is, and then they could pull it out during there and kind of go through the questions that way. So that's another way to utilize this tool.
And the entire Youth Health Literacy Guide is available for download from our website, and we debated having each individual tool separately downloadable, and we opted not to do that because it just took too much space. But if you as a provider or teacher want to download the entire guide, we did make each tool a distinct entity. So if you notice on this screen at the very top it says tool 15, at the bottom it says tool 15. So you could take the entire PDF and take out one page and email it, or post it so that they could get just that one tool if they want to be able to just pull that one tool up on their phone, or however you want them to use it. Or you could take this, this was intended as a wallet card, so if you want to take this document and print it, you could shrink it and do whatever you want with it if you want to pass it out. Same with the assessment. If you want them to have the assessment as they're setting goals for themselves, you could take that out as a subset of the entire guide as just one tool that they would be using. And that was the intent of the guide, that we know that teachers and providers do not have a lot of spare time to be reading 5 million tools. You might have time to just use one, and that is great. If anybody uses any of these tools for the benefit of young people, we will be very happy about that. So use them as you wish. And this tool was, I should say, and several other tools were created in partnership with Envision New Mexico, particularly with Caitlin Adams. So we appreciate that partnership. And I think we'll come back to these reflective questions, but I wonder, Michelle, if you could bring up the rest of the guide. While you do that, I'm going to flip over to the references real quick and just for the sake of the recordings, folks can see that where some resources are for them. So the first tool under the references is our website and the sub-tab that has this guide as well as the briefs that we talked about. And we wanted to give credit to the Healthcare Transition Initiative of the Institute of Child Health Policy at University of Florida. They have a lot of great tools. Their focus is on young people transitioning because they have special healthcare needs or they're in the foster care system and so forth, and them needing to become advocates for their own self-care. So we had to adapt this tool for the population we were intending. But we want to give them credit, first of all, but we also want to point to these other resources that they have that may be of great interest and use to you. And again, going back to what we said at the beginning, this guide as well as this webinar are funded through the Office of Adolescent Health, Department of Health and Human Services grant to the New Mexico Public Education Department. So going back to the Youth Health Literacy Guide, Michelle's going to bring up the entire tool. And as you see, there's 35 pages, separate and distinct tools. And thank you, ma'am. And we're going to navigate a little bit through here and give you a snapshot. Hopefully we will not make you motion sick in the meantime. I should add, and I won't flip to the very last page, but the very last page of the guide is a letter of attestation by two nurse practitioners who have both worked in the school-based health center setting. Neither Kim nor I nor others who worked on this tool or this entire guide and the tools that it included are medical providers. So we wanted to make sure that we got them from reliable medical sources and that we had medical providers look over the entire guide. And so we do have that letter of attestation and did have a review by medical providers and school-based health center medical providers in particular, so that you can feel confident about sharing this with young people. So here's tool 2. And this, and in fact, this is a tool, I mentioned the Family Feud style game earlier. This is a tool that is part of the Family Feud style game. This is good for all students. Honestly, this is good for adults. Anybody who's trying to decide whether they are going to their primary care provider or other sort of appointment out into the future kind of visits, what they need to go to urgent care for, and whether those are appropriate for a school-based health center or whether they need to go to an ER. And even someone with low literacy, because of the happy faces and frowny faces, you can kind of get an indication. And then the green, yellow, red light feature, it's hopefully a very user-friendly tool to determine where you need to go. And often new parents, first-time parents, are more often to be frightened for their children than they are for themselves. So we'll often take their children to the emergency room, but there's often a cost associated with that to the healthcare system and to them as individuals. So this is a really good tool to share with them. And I'm pretty sure later in the Youth Health Literacy Guide, we have reference to the Nurse Advice Line. That's another good resource for expectant and parenting teams to help get guidance about which of these categories of the healthcare system they should be accessing. I, as a parent, have used the Nurse Advice Line myself to determine if I need to go to urgent care and drag my baby out in the middle of the night, or if it can wait until tomorrow. So this is, I think, a really good brief tool that school-based health center providers or grad staff could use. Does anybody else want to add anything about this tool? Because I know a number of people in the room have worked on this and utilized this. Um, there's this little note in the right-hand corner that I want to point out. Bring a copy of your insurance card, whether an expectant parenting teen or expectant or parenting. Hopefully they're not expectant and parenting, but they could be. Um, if they are still living with their own parents, they may not have a copy of their insurance card, and that's a conversation you may want to have with them, that now is maybe the time for them to start keeping a copy of their own insurance card. A lot of times parents hold on to that as a method of control or just to support them so they don't have to worry about it, especially if they're, as McCain said, a teenager who loses papers. But it's something they need to get acquainted with and something that they need to know at least where it is and where it's stored. And there's another tool here that I want to drive us to that's about health insurance cards that I think can be a really good resource, again, for anyone, adult or youth. How to read your insurance card. This is tool 6 in the guide. And this is split in half. There's one that's sort of, and of course every insurer has a card that's a little bit different. So this is a guide, not a, guarantee that this is exactly what an insurance card looks like. But if a young person is privately insured, the top half of this tool gives a sense of not only what might be on the card, but what it means, since there are acronyms and terminology that are utilized that might be foreign to people. And then the second half, the bottom half, is what the New Mexico Medicaid card might look like. And because in school-based health centers and really in any kind of clinic, you can be looked up by your Medicaid number. A lot of times people don't carry their Medicaid card with them. It's helpful to have it, but if they know their number and they want to write it down in their phone somewhere, that's another option for young people. But they may have their own card plus their infant's card as well. So they may want to use this tool to get familiar with what they need to know. And if you look at this portion of the card on the private insurance side, some of the terminology here, copay, specialist, there are a lot of tools in the Youth Health Literacy Guide that talk about vocabulary and explain the odd and complicated language of the healthcare system. So that's another thing you may want to consider working on with the young people that you see if you know they're accessing the healthcare system. What is an MCO? What is a copay? What is a deductible? Sometimes those things are so confusing and embarrassing when you don't know them that people stop accessing healthcare because they don't know. So that's another tool. Does anybody else want to suggest a tool that they know we should look at?
I think 8 is important. 8 is how to make healthcare appointments, and that one came up several times in the crosswalk. So this kind of would be a really good tool to go over if you had a group or an individual who wasn't sure how to even start to make an appointment. So if they just found out they were pregnant and they came into your school-based health center, how they would call to make an appointment with a OB. And it talks about what you need to have before the call, that they're going to ask you these questions so that they're ready and it doesn't surprise them if the scheduler asks them, why do you need to be seen, or how they can kind of talk to the folks when they call about how to set up their appointment and what they actually need. What's number 3 on that? Be ready to answer questions. Asking questions yourself. So if you want a female provider, making sure that they know that they are entitled to ask for that. They don't have to just see whoever the particular office wants them to see. Asking them if they have experience with teens, with younger moms, all those different things. So I think this is a good tool, and it does crosswalk really well with several of the ones on the assessment, both on the am I ready to advocate for my own health care, maybe while they're pregnant, and then transitioning into am I ready to advocate for my child's health care and make appointments for my child and not just for myself during pregnancy.
And one thing that I thought of including in the slide deck but didn't was an idea for a classroom to role play. Nobody wants to admit they don't know anything. Adults are worse than teenagers usually about that. But if you make everybody role play this, then no one has to admit that they need help doing this. And I am always surprised how many people and teenagers in this current generation in particular don't know how to use the phone, don't know how to find phone numbers to begin with because no one has phone books anymore. That's dead technology. And so many things that young people do are online now. And there are some systems in which you can make online appointments, but even here in Albuquerque, often you need to make a phone call to take care of some of this. So having everybody role play it so that everybody feels comfortable might be the thing that gets them to make an appointment instead of being embarrassed, feeling stupid, and not going. I was talking with a grads teacher at a particular campus not long ago, and she indicated that her grads, I mean, they didn't share this in the classroom setting, they shared this with her as individuals, but a lot of them don't go to appointments because they don't know what to expect when they get there, and it's intimidating, and so they just don't go even if they have transportation. So you might also, and this is sort of going on to the tool, the follow through, you might even bring or role play what happens when you get there. And it's different at different kinds of clinics, different kind of providers. So there's no guarantee that how you tell them it's going to go is exactly how it will go, but practice it makes a big difference. You know, even some research has shown, even if you have 3 questions that you're going to ask your provider, if you write it down and put it in your pocket, even if you don't pull it out of your pocket and look at it, you're more likely to ask a question when you go to the appointment. So doing some practice up front could really help these young people. So here is tool 9, which Kim just referenced. This is the young people, their own self-assessment. So it's very similar in terms of some of the categories and so forth to they're getting ready for their child's health care. So you might want to split the group in half and have the pregnant or expectant teens complete this assessment, and then the assessment that we talked about earlier have those who already have children, or depending on how far along they are in their pregnancy, if they're the ones who is pregnant.
Do you want to go to the 18 before 18 because it's related? It's pretty related to this.
That is coming up soon here. Yeah, this you'll hear this term when you start looking at these issues. Transition is a hot term for helping young people prepare. So here's 18 before 18. And McCain, are these posters still available? Mm-hmm. So you could contact Envision New Mexico if you want I started to say life size, it's not life size, a large poster of this particular tool. This came out of Envision and Department of Health, right?
Yeah, and I would just say, you know, this is for students, you know, using that term transitioning to adult care, but as there is another resource in here around consent to care, and when you become a parent, no matter what your age is, you can consent to your own care, all of your care on your own. And so they may not be 18 yet, but a lot of these things will apply to them earlier than that once they have a child. So, you know, that's another caveat, but also something to start talking to expectant teens about. It's just that they're going to have a lot more control and ownership over their own health care in addition to their child's health care.
And this is not in the guide. This is my editorial comment. And I've heard people who work with expectant and parenting teens say this: with control and parenting comes responsibility. And I think that probably could seem like a very significant burden to young people, even if they're excited and are going to love their child just as much as anybody else would. All of these responsibilities, and healthcare is only one of them, could probably seem really overwhelming. And I think, and here's my editorial comment, I think that young people, adolescents, are at a stage in their life where justice is really important to them. And if you want to empower them and make them feel, if not excited, at least not afraid to tackle some of these things, if you emphasize that these are their rights versus that these are their responsibilities, that might be a tact that helps them feel a little bit more positive about these responsibilities, which they are. Because there are people who don't want them to have these things. And I'm sure if they're in a grads class, they already know that there are people standing in the way of them succeeding and them being good parents. So if you want to get them worked up and use that excitement in a positive way, you can talk about the fact that, you know, getting access to the travel rewards through Medicaid is maybe a pain, but it's their right, and they're doing something good for their child if they access that versus you have to do this and this is a big responsibility and you need to accept it and so forth. That isn't, it's not very effective with teenagers generally, much less the ones that are already concerned about this new life that they have to take care of.
And speaking of posters, we also have the Know Your Rights. I think you have the card in here, but we have this available both in poster form and in card form. So if you're interested, you can certainly contact us here at Envision and we can provide those. This is probably more relevant for the population that you're working with. This is for 14 to 17-year-olds, but we also have cards available for those that are 13 or under and can provide both of those to folks. And we will be distributing them to grads, teachers at the training next week.
Oh, and I think we're getting close to the end of time here, but I wanted to say one last thing, and I'm going to move to our last chapter. The majority of young people in grads classes and even that might be seen in a school-based health center that are expectant and parenting teens are the young moms, but grads is intended for young fathers as well. And we have an entire chapter on tools for young fathers and the self-assessment around accessing care for your child is for the young fathers as well. And I think it's important to mention that outcomes for the moms and the babies are better when young dads go to the prenatal visits, when they go to see the ultrasound results. They have their own health concerns, and here's an example of some of those things that impact their children. For example, if the dad is going to be spending time with the child and they don't get the flu shot, they might pass the flu on to the young child. So all caregivers, including dads, need to make sure they get the right immunization. If dads use tobacco and they are going to do that around the child, that impacts the child's health. So there are things school-based health centers can do to help the dads with their primary and behavioral health care needs, which may be new and different now that they're going to become fathers. And there are tools in this chapter that hopefully can help school-based health centers and grads serve the needs of the young fathers as well. I will say there are not enough tools out there for fathers, period, much less young fathers. So this is, I feel like, our weakest chapter. And if any of you know of other resources that we should add about healthcare for dads, we would be happy to add those. And it's definitely one of our goals. And I know especially if there are fatherhood mentors who view this webinar, that you maybe have resources that you're using with your clients that you could tell us about that we could add. We have quite a few websites here, and there are some one-pagers that young dads can get through fatherhood.gov that may be of interest. Not a lot of them are healthcare related, but if anybody wants to suggest other tools to add, please let us know. Does anybody have any final questions before we end the webinar? If not, I thank you for your time and attention, and please do access the resources on our website. Contact us if you have questions, and we will hope that this is useful to you and the young folks that you work with.
Thank you.
Thanks.